Today I will explain the difference between a fresh embryo transfer and a frozen embryo transfer. In fresh embryo transfer, what we see is the egg retrieval is done in a particular month, and in the same month when your eggs are stimulated, your eggs are retrieved, the eggs are inseminated with the sperm sample, the embryos are formed, and we go for an embryo transfer in the same cycle. So we have done pickup today. So after 3 to 5 days, we go for a fresh embryo transfer. What happens? Till 2010-11, we used to have maximum number of fresh embryo transfers. Now, in fresh embryo transfer, if the eggs are more, if the hormones are high, then the implantation rates would be lesser, because in high hormones, the pregnancy will not be supported by the endometrium. Or if the line of the uterus is not good, the fresh embryo transfer will not give result. Hormones are not matching, or if your uterus line is not okay, in those cases, the fresh embryo transfer used to give lesser results. So that's when the frozen embryo transfer cycles give better, because we freeze the embryo, we wait for the hormones to get normal, we prepare the endometrium better, and in the next natural cycle we go for embryo transfer. But there is other group of patients in whom the eggs are less. When we stimulate, if the hormones are well coordinated and we stimulate, we get 3 to 5 number of eggs or embryos. In those cases, what happens is, even if we freeze the embryo or fresh embryo, the risk of hyperstimulation is not there. If the endometrium is also matching well, in those cases, rather than freezing, if we do a fresh embryo transfer cycle, the results are equal or better, because it's in a natural cycle we are doing transfer, so we don't need to go for a hormone replacement therapy cycle to do a frozen embryo transfer. In a frozen embryo transfer cycle, sometimes we have to give estrogen tablets. In that, there is a medicated cycle. So if your hormones are matching well, and if your endometrium is also looking good, then a fresh embryo transfer can give you equal results as compared to frozen embryo transfer. The advantages of fresh embryo transfer and frozen embryo transfer needs to be understood according to what is their number of eggs, what is their hormonal stimulation, how the endometrium is matching. Then you can take a call whether you need a fresh embryo transfer or you need to freeze the embryos and go for a frozen embryo transfer in next cycles. I hope this information helps you. Thank you.